everyone. Welcome to a special edition of Preemie Chats today. This is part one of a two-part series that is celebrating International Kangaroo Care Day, which is happening on May 15th. Preemie Chats is a program that is for healthcare professionals and parents to talk about what matters most to you, to explore new ideas, and to learn together. I'm Leah Whitehead. I'm coming to you live from Halifax, Nova Scotia today. I'm a preemie mom and I'm a former journalist, and I'm happy to be your host. Preemie Chats was created and is put on by the Canadian Premature Babies Foundation, also well known as CPBF. The foundation is a parent-led charitable organization that helps families in and after NICU through education, support, and advocacy. If you have a heart for preemies, whether you're a family or a healthcare professional, I'd encourage you to head over to their website at canadianpreemies.org. It's there on your screen, and there you will find resources, the latest projects, and most importantly, a community of people who want to see our little babies thrive. Today's session is live, so please bring your voice to this table. Leave comments and questions in the chat, and we'll try to address those during our program. And it is through rich conversations like the one that we will have today that practice is advanced and we learn together. So please participate, and also let us know where you're watching from. As I mentioned, today is a special day. We are talking about kangaroo care. Now, what is kangaroo care? It has a cutesy name, but it is something incredible that has immense impact on the outcomes of premature babies. So to mark this special day, like I said, we're doing a two-part series, and we have some amazing guests lined up for you. Families who will share their stories and experience with kangaroo care, and then we'll do kind of a roundtable Q&A with those parents and a neonatologist. So stay tuned, and please write down your questions in the chat so that we can have some lively conversation about this very important intervention. Let's take a quick look at a clip that was created by St. Boniface Hospital in Winnipeg that looks at different techniques that can be used for kangaroo care. As you can see, it's a beautifully produced video. The full video is about 20 minutes long, and it's available on St. Boniface's website, and it covers a variety of techniques, including the parent-led standing transfer. The thing I love about kangaroo care is that it can sometimes feel like it's a small thing, just being skin to skin with your baby, but it's actually a medical intervention that has huge proven benefits. And so to kick off the conversation today, I'm going to be joined by Janeeta Gill. Janeeta is mom to 27-weeker Jack and 35-weeker Jet. Their family spent a total of 6 months in the NICU within 2 years, if you can believe it. They had the unique experience of being in the NICU pre, during, and post the COVID-19 pandemic. So she is going to share now what kangaroo care did for her family. Welcome, Janeeta.
Hello, and thanks for having me here today, Leah. I'm here today to share my unique experience of being in the NICU twice and the 2 different kangaroo care experiences that I ended up having. So I'm just going to start off with kind of like a background and profile of both my sons. Most preemie parents don't expect to have a premature baby. So, it was unexpected for my son to be born so early. I had a regular day at work, said bye to my coworkers. I went to labor and delivery because I wasn't feeling some, movement for a few days, and I thought nothing of it. But a few hours later, an ultrasound had revealed that I had placental insufficiency and Jack had stopped growing. And so the plan was to keep him in for a few more days. But he had other plans, and it was just like 20 minutes after that conversation, his heart rate dipped and he was born. And he was born about half an hour later. So some of his challenges was one of his biggest challenges was stabilizing his breathing. That was 90% of his hurdle, and he was on CPAP and intubated at times, and back on CPAP, then on high flow. He had quite a few infections. He also developed neck, and that's kind of what kept us there for about 4 months. So we found ourselves, in a similar situation about 2 years later, 2 years and about a week. My second pregnancy, I made it to 35 weeks and 5 days. We noticed the same thing happening again with my placenta. The function just wasn't normal. It became abnormal around 34 weeks. And the goal was to push a C-section to 36 weeks, but my boys love to have their own plans. My second son, Jet, came a bit even 2 days earlier. The Doppler numbers continued to just decline. And Jet was born March 9th, 2022. And he was a bigger baby. He was 210 grams. So he was 4.5 pounds. And we were like, oh my gosh, we made it, to almost 36 weeks. And he's much bigger. He's 4.5 pounds. We'll probably just have such a short stay, but we still ended up having a 7-week stay. His challenges included he struggled to stabilize his sugars the first few weeks. He had side effects to a treatment, and he also had difficulty with feeding. So going back to my firstborn, my 27-weeker, what our first week looked like was very overwhelming. I never imagined I would be able to hold my baby when I first saw him. He was in an isolette. He was tiny. He was fragile. The nurses had just said, you don't want to overstimulate him. You're allowed to do handheld hugs, but if you overstimulate him, that's not really good for his brain either. So knowing that and seeing how fragile he was, I never thought I'd be able to take him out of the isolette and hold him. So I felt really overwhelmed. I felt not important. I felt like a visitor, and no one did anything to make me feel like that. It was just the way I was feeling. I just felt like I didn't know how to care for him, but my son's medical team did, and they were most important. And I remember telling my husband, fortunately, we lived very close to the hospital, about a 15-minute drive, so we could kind of come and go whenever. So I would tell my husband, let's just go home. There's not much we can do here. We can kind of hold his hand and kind of watch him, but, let's just go home because he needs the doctors, he needs the nurses. About 6 days into our stay in the NICU, a nurse had asked if we had held Jack yet, and we had not. And this was the first time I had found out that I could hold him. And we made a plan to hold him the following day, but I was really shocked to find out about kangaroo care and how essential it was. So this is pictures of both of our first times holding Jack. I got to hold him first, and then a day or two later, my husband had held him. And what we noticed the first time holding him was it made me realize my important role in the NICU. I wasn't just the milk lady. Sure, I had to, provide him with milk, and that kind of put a lot of pressure and stress on me as a mom, thinking this is my one important job. If I don't provide him with milk, what kind of mom am I? And, even in pregnancy, I wasn't even sure if I wanted to try breastfeeding because I knew that, if you don't get milk, you could become very emotional about it. I didn't know if I wanted to try that journey, but, I did because it was the only thing I can do. Anyways, after talking to the nurses and doctors and realizing all these studies that have been done on kangaroo care, that it was essential that, in the 70s, research was done that orphans that were preemies that were left untouched were actually dying because they needed touch, they needed to be held. And that made me realize, okay, I need to come every day, and he needs me to hold him. This is important for his development, for him to grow and to get out and graduate from the NICU. The first time holding my baby was definitely memorable. Preemie parents definitely have a little bit of grief from delivery. Of course, while your baby's being delivered, your most important thought is you want your baby to come out and be safe and healthy. But it's after after that, you start to think, well, you look at your friends, your coworkers, your family, and they all have pictures of holding their baby that was obviously just born minutes ago, and you didn't get that moment. And you'll never get that moment back. You won't get that picture. And, it sounds kind of silly, but it's just something that stays with you, and it's small, but it's there. So being able to have kangaroo care in a selfish way was great. But knowing that it actually has so many benefits and is essential to your baby's development is even better. I was able to notice a difference in his vitals. It definitely helped with my milk production. I could feel myself producing milk when I would hold him. And I knew when I held him that he was waiting for me to hold him. I just felt his hand kind of move here and there. And I was like, he's been waiting for me. So how did it help us as caregivers? It helped create a bond between us and baby. When he was first born, I didn't feel like a mom. I didn't feel like his mom. I was just kind of like, oh, this is happening. But slowly, you start to develop that feeling of, oh, I'm your mom. You don't have another mom. It's me, and I'm important. It allowed us to create a routine beneficial for both of us and our baby. My visits were very short, like I said, that first week. But once I realized I needed to hold him, I had my full day was there. I was there from morning to evening because I wanted to hold him as much as possible, make sure he had that touch and that care. We made a schedule to hold him when he was uncomfortable. We noticed that when he had prongs in his nose, his heart rate would go up and he needed to be comforted. So we would hold him. And in this picture, you can see my husband's holding him. He has the prongs, and, it was something to help him regulate his heart rate and bring his breathing back down. It helped us to to know our baby better and his tendencies. So like I said, with the prongs in his nose, we knew when his heart rate would go to 200, the alarms would go off. It's not always an emergency. It's just he's reacting to having that uncomfort in his nose. We got to kind of know a baseline for vitals. So if we thought something was wrong, you kind of had a better idea. And it gave us time to observe him closely. And that is really important because we've had doctors tell us that, parents are with their babies all the time. So you know them best. And we could share our observations to help advocate for him throughout his journey. Kangaroo care was really important for my husband. Non-birthing partners have a different kind of journey. We know the NICU can be very mom-centric. So this allowed my partner to be very involved and for him to start to create that bond between him and his son. When he was with Jack doing kangaroo time, it actually took a load off me and gave me time to do things. It gave me time to think, if I needed to get my incision looked at, I'm at the hospital. I wasn't second guessing it. I was like, well, we're here. He's holding him. I'll go get checked out. And, that was great because one time an infection was starting to creep up. Caregiving also started to feel closer to being equal. And it's not a matter of it becoming 50-50. It's just that you want to feel that both people are involved in the care and both people kind of get to have that bond. So this is something that I didn't really think of too much when I was in the NICU, but thought about it after, but comfort. And I really appreciate how the nurses made me feel comfortable. I was provided with quite a few options for kangaroo care. You could be bare chest in a tank top. You could use a tie or a wrap. And I'm someone who's just very self-conscious, and my first time I wasn't comfortable being completely bare chest, even though there was a curtain there. So, we had said we could put him inside my tank top and he's still getting kangaroo care. And I really appreciate that because, it was comfortable for me, comfortable for him, and comfortable for everyone. This also meant, though, that I could have more support, like my other family members come in and provide kangaroo care if they needed or if I needed. And they could feel comfortable, like my mom could come, so his grandma or, an uncle or an aunt could come and hold him. And they don't have to be completely bare chest, but putting them in their shirt or in their tank top is just as helpful. And it's always important to find ways to expand your support system in the NICU. So we had the unique experience of going through COVID-19. My son was born about 2 weeks before lockdown. And, then we got a notice, that's the picture that I have, that only 2 people were allowed. So it would have been, the caregivers, my husband and I. And then a week or two after that, it was even more restricted to only 1 parent in 24 hours. So my partner and I, we had to alternate visiting days. So the days that I wasn't with my son, I was obviously at home spiraling. It was like me in the media thinking, oh my gosh, what's happening in the hospital? The media is saying like, this is so contagious. This is, it's a horrible thing and we don't know anything about it. So, I'd have like all these scenarios in my head, like what if a nurse has it and touches him? And what if my baby gets it? And there's no cure, there's no studies been done yet. But what I found was, even though I was very stressed out then, when I would go hold my baby at the hospital, it was very grounding and it was really helpful for my mental wellness, because that moment that I would hold him, I wasn't spiraling. So it reduced my anxiety and it brought peace. Not all the time, not when the alarms were going off all day, but most of the time I was like, no, he's fine. He's on me. He's doing well. He's growing. He's making improvements. And I started to like not think about what was going on in the media. So we know that kangaroo care is also important for caregivers too, because it was reducing my anxiety, my stress, and we just both need hugs. We don't have time to go to the spas, and especially during COVID, everything was closed down. So your self-care was really difficult, but that kangaroo care time actually is a little bit of time for you to care for yourself. And I really appreciated that our hospital allowed us to continue this care during a pandemic, because I'm sure there could have been discussion around maybe stopping this or, a different way of doing it. But I think we all know it is so, so important in our baby's development. We know it's essential, and that's why it continued. So our second baby in the NICU, and how I felt about kangaroo care, I was more confident, I was more comfortable. The first day I had asked, when can I hold him? And we made a plan to hold him the next day. And I was more comfortable, I was comfortable being just like in my nursing bra and having something over me because I get cold a lot. But it was just a different experience. I knew from the moment he was born, he needs me, and to ask these kinds of questions and to hold him right away. And he needed me from the beginning too. The first time I held him, he clung to me, and I just knew he was a hugger, and he's been waiting for me as well. I already also knew like the handling schedule and how to organize time around his feeds. So that was all great, because, it wasn't so much of a shock. It wasn't so much learning. I kind of knew. I got in there, I did it, and I felt great about doing it, as soon as possible. However, I did feel guilty because I wasn't able to hold Jet as much as I did with my first Jack. We had one baby then, no children at home. So I could spend the entire day at the hospital. But when you have other kids at home, it's become the struggle to balance your time between them. So it was great for my toddler to be able to come into the hospital, and while I was holding him, sit with me. You could read a book together. You could spend time with both kids together, even though it might be really short. My toddler at the time didn't have a really large attention span, but he was, able to sit there for a few minutes. We could watch something together or sing a song together. And like I said, it's difficult balancing your time between all kids, and you do have that guilt. And also, we make kangaroo care sound so magical, and it is, but I don't want people to feel guilty if they can't make the time to do it every single day. And I think it's one of those things where, as long as it's done, and it doesn't matter how much, any time that is done, that's what's important, is that it is done, not how often. So kangaroo care supported Jet's development just like it did with Jack. It provided him with emotional comfort. We noticed it was regulating his breathing, his heart rate, and he was having good weight gain. So what did Kangaroo Care do for my family? And it did a lot. And you don't think about this, you really focus on the baby and think it's so essential for the baby, for their development. But it helps all of us, it gave us all important roles and feeling of involvement. It created strong bonds between my husband and our baby, myself and our baby, and my son and his brother. It allows us to expand our support systems. Like I said, you can have other family members or friends or support people come in and hold your baby and provide that care when you might be feeling ill or something like that. It helped mine and my partner's mental well-being. Like I said, during COVID, I'd be worried, oh my God, I'd go home. Did I pass on any germs to him? Because, the symptoms of COVID don't happen till later. It comforted us all. It supported my toddler's understanding of having a brother. And, while we were balancing our time between home and hospital. And it's amazing that this simple touch, all this promotes emotional, physical, and cognitive development in our tiny little babies. So it's really amazing. And thank you to the Canadian Preemie Foundation and Leah for letting me share how wonderful it is and what it's done for my family.
Thank you so much for your presentation. I just think, I mentioned before how powerful it is to hear from families, but I can't overemphasize, because when you said, I'm your mom, I'm important, when you had that realization, that's a huge realization for NICU parents. So thank you. I have questions for you, but we're not going to get to those right away. We're going to take a few minutes, and I'm going to introduce you all who are watching to our next guest, Petya James. So Petya has 3 kids who live with her, but she considers herself to be a mother figure to 8, and that includes birth children, stepchildren, lost pregnancies, and siblings she has raised. Her last baby was a preemie, Raya Star, born at 28 weeks, weighing 1,240 grams. Currently, she's 1 year actual and 9 months corrected, and they spent 115 days in NICU. Professionally, Petya is a trauma-informed therapist and has a background as a registered massage therapist. So she used these experiences to help her and her baby in NICU, focusing specifically on the healing power of touch. Welcome, Petya.
Thank you so much, Leah. Thank you so much for having me. I probably am not going to do this whole thing without crying. And that's okay, because we're talking about something that is so deeply felt by so many people. So I'm actually just going to share our story. I do have some slides that I want to show, but really just wanting to share the story as we experienced it, because it's unique. Everybody goes through their own journey, instead of really teaching slide by slide. So I might go sort of fast and then slow down with my slides. So this is Raya Star. She was born on April 21st, 2022 at 1,240 grams at 28 weeks. She's currently 1 year. We just celebrated her first actual birthday, which is how I am starting to count her age. I personally am starting to correct her own age without having to mention it every time. She's doing amazing. So I wanted to share our perspective on kangaroo care and how, again, because of some of my background professionally, I'm trained to work with prenatal women and postpartum, and I have my own kids. So I knew that when my baby was born premature and when I was able to actually hold her, I was all into that. I could not wait to have her on me. I didn't know what it would look like. I had no experience with other preemie babies, but I just could not wait to have this baby on my body. And at the time, it felt like I'm about to nurture this baby outside of my body for a whole trimester. I don't know what my mind was doing at the time. I'm pretty sure I was overwhelmed, But I just knew that the ability to hold my baby was going to help both of us. And I didn't just yet know how. But I'll never forget that first kangaroo care ever. So this is it. This is a picture of the first time I got to hold her. Just to back up a little bit, she was born, and of course, immediately she went on CPAP. But her breathing was quite stable and began to stabilize even more. So the first week, while the tests were running and all the different things were being examined, of course, that was really hard. Thankfully, she didn't have any known medical issues at the time. So it was just about time and letting, the medical team take care of her. So I made it my job to show up every single day. I made it my job to show up there for rounds every single day. So we initially were at Mount Sinai Hospital in Toronto, and rounds started at 10. So I immediately stopped working. I am self-employed, so I could do that, and canceled all my appointments and started showing up at 10 a.m. every single day to do kangaroo care. I wanted to have her on my chest, and knowing what I know, I want to share with you something that really helped us. It was an intentional something that I did every single day when I was holding her on my chest, and I think that is the very thing even Janeeta was talking about, that it really helps everyone. So meanwhile, while I wasn't at the hospital, this is Maya, my 4 at the time. She's now 5 years old, child at home. So I would do a 9 a.m. drop off at school, and I would be on my way to the hospital until 2, where I can go home and pick her up for dinner. And sometimes I would go back to the hospital for the evening shift after 8 p.m. My husband had to, of course, work. He was the one who was able to kind of carry us afloat during this time. And I'll come back to this slide here. So really, it became this adrenaline-led state. I want to take a moment here to mention where I really began to focus here, because what I realized is that I really needed a way to take care of my nervous system. I wasn't thinking about self-care in a way of, oh, I need to rest and I need to, um, get massages or something in a way of self-care, because I was in a state of fight, the fight or flight in the nervous system. I was in a state of shock. I was in a state of, I've just got to get this going. I got to make this happen. And I could recognize this about myself, because that is what I do. I work with that, and I support people. And so all of a sudden I was going through that experience myself. So I knew that if I could take my own advice, I would find ways to really work on my own nervous system. And what would that look like? So at the times when I was able to hold the baby, I started to do really intentional things. So for example, as kangaroo care would start, I would hold her on the side of my, on my chest, usually on the side of where my heart is, which of course it's right in the middle here. And I would place her really close up to my chest where she could feel my heartbeat. I then focused on my own breathing. I really wanted to be intentional with what I'm thinking about at the time. What am I doing while I'm doing this kangaroo care? And when I first found out that I was pregnant with her, one of my initial thoughts was I was afraid that I couldn't be as present with this baby coming as I was with Maya, who was 4 at the time. I'm a present parent. I really wanted it to be intentional with all the things. And with her, I was really able to do that. And when I found out that I was pregnant, there was a fear in me that I couldn't be as present as I was before, because of another child and different responsibilities. And so when this experience came for us, when she was born so early, there was nothing else I could do to help other than be present. And once I realized that, things kind of shifted in my own mind, and I knew it was going to be a long road, but I had to remind myself that the only thing I could do and be helpful with is to create a safe, comfortable, healing space. And that had to be within me. So when I would go and hold her for kangaroo care, I would put her on my chest where my heart is, and I would start to focus on my own breathing. I really wanted to be that present and that intentional. Although I didn't know what else was going on in those moments when I got to hold her, there was nowhere else I could be, nothing else I could really do. And so I just wanted to be present. So I started to focus on the breathing. And then I began to incorporate humming. So this is something that we still do. She loves to fall asleep this way. I'm not mad at her. I'm not fast at trying to train her into anything because this one clearly has her own path um, and timeline. So I began to do this thing where, and if there's somebody watching here and you're in the NICU, feel free to try this and make it part of your practice. So as I'm breathing, I'm going to demonstrate a little bit. It's a big breath in as the baby's on my chest, and then I would I would find some sound, like a very gentle sound on the exhale. I don't know if you can hear it. I'm just humming here, but it's a vibration that comes from the heart. So I really put all my energy into knowing what I need to do for my own nervous system. I know that that is calming to me. And as she's on me, all she really feels is my vibration. So the person who is doing the kangaroo care is really essential so that this little baby can begin to help her own nervous system and to co-regulate. And that was the biggest focus in my life. And so with touch, of course, I'm hands-on with her. I have my hands literally on her body, as you could see. I'm humming, and it's this beautiful kind of dance energetically between the mom and the baby. And that's what I called nurturing my baby outside of my body in the third trimester. Now, if you really think about that statement, that's not a lot of, like, it's a whole other level. Let's just say that. Not to minimize the experience of a newborn, even if they're not a premature baby, and this is wonderful for that as well. But when the baby, this little human has chosen to come so early, and they have this little body, and they're going through an array of experiences already that early on, it's been wonderful. So this is what we did. The hardest, I wanted to share this, that exactly a year ago, and this is something I feel so proud about sharing exactly a year later, not longer than a year. It has been at this moment of me sharing the story. It's when we did have a COVID exposure, and I wasn't able to be with her with that presence that I intentionally wanted. And that completely shattered my heart in so many pieces. That's probably the hardest ever thing that I can think of to go through. And here we are a year later, and my baby girl is doing great, but those moments were so painful, and needing to kind of process all this trauma, because this is what it is. Again, this is coming from a professional background. I know that this was traumatic, and it is traumatic. It is a traumatic experience. So being able to hold myself and lead myself and navigate this through with my own system, that's been incredible. So I was able to advocate, or just, I don't know how it came to me. I asked if I can have an iPad close to her isolette if I'm not able to come in, and I just played music and I sang to her. And again, the whole intention was that she feels my presence. I thought that that was the most important thing that I could give her this early on. So this Kangaroo Care with Touch has been incredibly beautiful for us. I want to share another way that touch was really helpful in our NICU stay. So she didn't have any medically known conditions, but she did have a feeding issue later, and hence we spent 115 days in the NICU. That's almost 4 months. But this is the second NICU. After Mount Sinai, we were transferred to North York General, where we spent most of the time with the feeding challenges. This is the first time the sisters got to meet her. So I have the oldest one was 18 at the time. The youngest one was 4 at the time. They're 19 and 5 now, and we're a blended family. So if it wasn't for our dynamic the way it is currently and has been since the pandemic, I don't know what we would have done, because I did spend most of the time, all of the time, in the NICU with her. My husband was at work all day long, and these two girls stayed home together. We FaceTimed a lot, and they, would make crafts and call their sister and just send her all the love. So coming back here, in the NICU, I was able to have my friend come and visit. She's a wonderful osteopath, and this is what we did eventually end up having to do and work with. The feeding issue we had was not medically induced, although they did want to treat her for reflux, and we did treat her for reflux, but she had the NG too. And so when we started feeding her around 34 weeks, of course, as recommended. When we moved hospitals, her CPAP mask came off. She was doing great breathing. She never had a DSAT or a spell, this one. And the only issue that started to develop was feeding. She just started to develop an aversion towards bottles and breast. I tried the breast. She was interested. I had a lot of milk, a ton of milk that I was pumping round the clock. We had to buy an extra freezer. The milk was not the problem. It's just she wasn't taking volumes. And so week after week, we tried to figure what that was. We gave her a bit of a break because, we didn't want to over push with her mouth. She wasn't taking volumes from the breast. So we started introducing bottles, and that again created an issue. She just wouldn't want to take it. And so that became this, I can't figure out what's going on situation. The team and the medical team, we looked at so many different ways, and maybe intolerance or a sensitivity in the gut or something, or formula. We're trying to change things, and nothing seemed to work. We had given her medication for reflux, and this went on for weeks. So that kind of stretched out, and that's where a lot of our stress started to happen, because I was feeling so defeated. I had no idea what to do or how to help this baby feed at the time. And she would look at me with her big bright eyes, and she would just, as if she was trying to tell me something. So eventually on August, or almost August, this is now 3 months later, we were about to go home. We were at about 48 hours to leave. She was drinking bottles, but not the exact amount the doctors wanted to see. So they said, we don't feel comfortable sending you home just yet. She ended up going back on the tube, and at that time I felt completely defeated. And so I ended up advocating for her to come home with the NG tube, and that we were going to take it from there. We're going to figure it out, because there was just nothing else the medical team could do for us. I was living in a room there with her, same thing. I was doing all the feeds and NG tubes and all the things from there. And I just thought, we need to go home. Our family needs to be together. So we ended up going home with the tube. We ended up going home with the tube, and I then started reaching out to all of my colleagues, people that I know, on somebody who could support. So all OTs and pediatric physiotherapists and a dentist and a speech and language pathologist. So it did turn out that it was a structural issue that she was dealing with. So her tongue was low functioning. She has a high palate and she had a tongue tie. And so all this, the combination of it all, it was just making it very hard for her to suck. Now that she didn't want to, she just figured it doesn't really work very well, and she wasn't doing it. So I started to do work touch again inside of her mouth. Again, I want to say I'm trained to do this. So I am trained with adults, not with infants, but I figured, you know what, this is my baby. I'm going to do everything I can for her. So I began to treat her mouth and her tongue inside. So I would go in with, my finger, and I know the anatomy. So I was working on the function of the tongue and trying to increase that, for weeks at a time, to desensitize that gag reflex, to help her tongue really move around. Because if you're about to suck something, the tongue has to do something very specific, and her tongue wasn't able to do that. So I worked with her hands-on with that for a few weeks, and then we had a tongue released by a dentist actually it was Halloween last year, 2022. And literally that day, I kid you not, she pulled out her tube and she's been drinking bottles ever since. And I am so happy. I just love sharing this story because, my goodness, I just love sharing that because it shows my baby's resilience, and also my commitment to advocating for that, for her and for ourselves. Because you know what, if it wasn't for the teams and the medical team and the hospitals and all the care and the amazing staff at all the hospitals, NICU staff is just the whole next level of staff, right? We wouldn't be here. But also, if it wasn't for our perseverance and determination and love and support and acceptance of what we're going through, it would be such a hard journey. So I just want to say, being intentional and close with our babies, even in these difficult situations, is essential. Kangaroo care is not just holding the baby. I believe it has to have this meaningful connection. And the way it works now is, oh, I forgot to say that we went through graduations and ceremonies while in the NICU last summer. We finally got home in August, August 15th. Kangaroo Care, this is her big sister and her dad. We carry her, all of us, on our bodies all the time, and we all love it. Big sister Kangaroo Care is the best. Kids need kids. My daughter loves being around her sisters. She is developing so much quicker because she is having that interaction with her sisters and laughing and playing, and it's just a beautiful thing to see. Here's my 5-year-old Maya. She's a great babysitter. This was a screenshot I took from my phone while I was attempting to take a 2 to 3 minute shower. I'm sure moms here know exactly what I'm talking about. But I thought it was just so cute. Here is us at Christmas, and it's just such a beautiful thing to be able to have our family dynamic work through this process and support each other and be with each other in the way that we really all deserve and desire. And like I said, my main focus as the mother and the leader within our family dynamic, the co-leader, I should say, because my husband leads as well, sort of from the back, it's our main goal is to really remain calm and centered so that we can deal with the stress. And like I said, I believe that being able to regulate our own nervous system and emotions as parents, and especially NICU parents, especially through that difficult time that we have to go through, I think that's the most essential thing. And the baby grows and they develop because they feel that we are handling that, and if we're not, that's okay. If we're not handling that, that's okay. There's help and there's support. And I know it's a cliche to say, but you're not alone. And I just want to say thank you so much for this foundation and Leah and the organizers who you put so much into this. And I have had wonderful experiences with the group therapy sessions that happened, and like even some private therapy that I did with a NICU experienced therapist. Like, this is necessary because our kids need us to be the best we can be so that we can support them. And I see myself as someone who, I'm not like, especially this experience has made me realize that it's not, nothing really is up to me when it comes to my kids, that they come with their own desires and dreams and just their own being. And my job as their parent is to create a safe enough space for them to be able to express themselves, to grow into who they are here to be. And I don't want to put any limitations on that. So I believe I have someone extraordinary. I have a few extraordinaries here. And I'm just excited to see where we go. And I know that it's not going to be easy and a walk in the park every day or every year. But you know what? I feel like I'm committed to being the best person I can be to lead the ship, and that's really all I can do. So thank you so much for this opportunity to share.
Thank you for sharing, and thank you both for sharing. I'm going to pop up this little comment we got from Cindy McNeely while you were sharing there, Petya. So important to hear your story once again. I know it's so difficult to repeat it, but people need to hear. And I think that just echoes kind of when families are willing to share their experience. I know that we revisit an emotional space that is always very close to our hearts. And you talked about that, how close it is. So I really appreciate you both taking the time and the emotional space to share today.
Thank
I'm
you.
going to bring in our final guest, and he'll be here for our Q&A time together. We have Dr. Eugene Ng joining us. He is a neonatologist and chief of newborn and developmental pediatrics at Sunnybrook Health Sciences Centre in Toronto. He's an associate professor of pediatrics at the U of T, an associate scientist at Sunnybrook Research Institute. And Dr. Ng combines his expertise and passion for seeing families thrive. And he's joining us to answer questions any one of us may have. And Petya and Janeeta, feel free to jump in with either questions or answers. Thank you for joining us, Eugene.
It's a pleasure to be here, and it is a very powerful stories that I've just heard. So thank you, Petya and Janeeta, for sharing. It's wonderful, and you both brought different perspective of kangaroo care to what we wanted people to hear. And I really must say that for your story, Petya, that I think this is what family integrated care is all about. And you went to Sinai, you knew Dr. O'Brien, and that kind of advocacy work for parents to have their voice in advocating for their children is really powerful. So as much as we're here talking about kangaroo care, I think that aspect of what you described was really what we wanted to achieve. So thank you for sharing that.
Yeah, thank you.
I wanted to kick off our time by asking you, Eugene, we'll start with you, of whether you've seen any evolution or improvement in the realm of kangaroo care during your time as a neonatologist.
We looked into the advantages of kangaroo care for decades. As you know, there's plenty of research coming out on how kangaroo care may benefit mom and babies. And for term babies, for sure, we have a lot of discussion and sort of echo what our two guests had talked about in terms of the not just for comfort. There's also a fair bit of literature talking about the use of kangaroo care in pain relief, and especially for babies undergoing heal lenses for blood sugar monitoring, for example. You know, the benefits of kangaroo care, it goes more than just really a bonding. I mean, that's probably the most important thing. But you know, we've seen people doing studies looking at you know, the benefits for settling respiratory rates for babies who had mild breathing difficulty. We have heard about the benefits of kangaroo care in stabilizing blood sugars for some babies who may have been at risk. You know, and also in regulating body temperature. So these are very, very clear benefits of kangaroo care. But of course, you know, what we're really here to talk about is the benefits of kangaroo care in a developing baby's brain. You know, that I think our guest has already talked about some of that. And I think there are evolving research talking about, you know, not just kangaroo care, but a bunch of these intervention that we call nurturing encounter. And I think we sort of talked a bit about that, you know, you know, especially for the preemie babies who are developing at a rapid rate. I mean, the brain growth has been going through rapid development during the NICU stay. Any of these positive stimuli being introduced to counterbalance some of the more noxious ones, like blood work, doing interventions, procedures, bright lights, sounds, that kind of stuff would be very helpful in how the brain is wired. And so we're seeing some more of those research coming out of you know, some people who are looking at this whole idea of the connectome, meaning that the pattern of how the brain is being wired as sort of a metric of how you have set yourself up for a long-term developmental outcome. And some of that positive stimuli, such as kangaroo care, and I think kangaroo care of all the things are one of the most powerful one that mom can do to you know, to really counteract all the negative stimuli from being in a NICU environment. And so, you know, I think that role for parents are very, very powerful, and you would never underestimate that. No, now maybe just one more point before we move on is you know, we've mentioned about COVID and some of the other circumstances where that makes it difficult for these things to happen. And you know, obviously that's a barrier. You know, but there's also you know, other ways around this. And so, for example, very small babies who may not be medically stable, people worry about the risk of kangaroo care. We could do a modified approach. And so we have things like hand hugging, or doing modified kangaroo care by not putting the baby out, but mommy going into the incubator and hug the baby. There are many ways to do this, as long as we know that this is the power of touch. This is the power of interaction between parents and baby. And thank you for pointing out that dad is not always being emphasized in the unit. I think this is kind of an important time for us to emphasize that dads are important too. Yeah, so I think these are my thoughts after hearing these two stories.
Petya and Janeeta, did either of you feel the hesitation because often there is that shock, and I think one of you even mentioned the shock that our body and brain kind of goes into when we have a premature baby. So did you have the hesitation or a fear of holding your baby?
Absolutely. Terrified, even like for so many reasons, right? Like they're tiny. You just keep thinking about germs, right? I don't know why, but my brain was like, they're in an isolette to protect them from germs.
Oh, interesting.
Right? Even though I wash my hands, I'm not like scrubbing my body, you know, when I'm coming into the NICU. And I don't know, I just like had this fear of like germs and getting the baby sick. And my baby's 1.7 pounds. How is this baby going to fight infection? You know, like when we're sick, we have a cold. How do we feel? What about this preemie baby that's not fully developed? And then like I would have like images when the first time I was even holding him, like he's so fragile, thinking about the transfer, like what if I drop him? I don't know why that came into my head, but it was like a little thought, and it just came in. And like there's a lot of hesitation and a lot of like fear of, you know, this is good for their development, but like there could be so many risks, and you're not a doctor. You also never done this before. So you're just like going through all these things in your brain, and you just want to do the best thing for your baby. So I think it's natural sometimes to hesitate because it feels like such a big decision.
And Janeeta, did you feel the same way with both?
No, so I felt very different with my second because one, his gestational age, he made it to 35 weeks, which is so different from 27.
Yeah.
His weight was different. He was 4.5 pounds. And I knew from my experience with Jack, him being 1.7 pounds, that had a lot to do with his development. That had a lot to do with why things were so slow. It makes a big difference, their weight. So when my 35-weeker was born, I was like, he's a bigger baby. He's made it farther. He's a bit more cooked. You know, we've done this with a smaller baby. You know, this is, and I knew he needed that touch. Like my husband and I always say, you know, that first 2 weeks that people were allowed to come visit, we said we wanted people to come see him. We want him to feel the love, the energy. Like that is so important in their development. For them to feel love, for them to feel comfort and safety. So, you know, we had grandparents come and we had our siblings come and we said, you know, this is your nephew, this is your grandson. Like, please come. You can give a hand hug, just obviously follow the rules, but he needs to feel that touch. He needs that love to grow. So I knew right away when my second was born, he needs me to hold him. And like I said, he like clung to me. Like he was waiting for me to hold him. He waited a full 24 hours. Yeah.
Just wanted to make a comment about what Janeeta was saying about germs, because I think that's important for us to point out that, I mean, I totally get that. And we do, of course, emphasize about hand hygiene in units, because that's obviously is the most effective way of preventing pathological organisms to spread through the unit. You know, but I think there's one more important point about that is, you know, we have a lot of good bacteria that is in your body or on your body, and you know, so some that transfer to the baby is actually your baby anyway, is particularly important for colonizing these healthy bacteria. And remember that the NICU environment is such that, you know, we sometimes use antibiotics, and that really could mess up the flora of bacteria in the baby's gut. And so one way of recolonizing those is actually to do things like kangaroo care, when your healthy germ are passed back onto your baby, and that's kind of important. So I you know, I don't think we really recommend people to sort of scrub clean. We actually do that when we did a study on an alternate female to do kangaroo care, and I guess Dr. Johnson also did another one of that, and so just to look at the alternate when moms or dads are not available. And of course, during those protocols, we do ask people to scrub, because I think, you know, other people's germ is not quite the same as your germs to your babies. So that's an important point to point out.
Thank you for bringing that up, because I was actually going to ask you if you had any advice or tips for parents who worry, because, you know, like, you know, preemie parents, we worry about everything. It's just, you know, you worry about, yeah, it's natural. I mean, you worry about a full-term baby, but then you have a baby that's really tiny and has so many hurdles and challenges. And I think that's a big one, even talking to other parents, like you're always worried about infections coming up and germs. And like I said, when we were going through COVID, I would always be paranoid. Oh my gosh, I held him today. Did I pass something on to him? But it's, you know, reassuring and a little stress relieving to hear kangaroo care is still important, and that there's good bacteria, and that the parents actually have bacteria that your baby needs.
Yes, absolutely.
I think my experience was a bit different. Again, I think what was driving me, like I actually couldn't wait to have this baby on my body, like to be in contact. I was quite connected, and through both my pregnancies, with the baby within, you know, inside of the womb. So when she came out so early, all I could think about was she needs to be inside of me. So when I found out that in a couple of days I can hold her, I literally could not wait. And then when I couldn't hold her, that was the hardest part for me. I was not as worried. And of course I was in the back of my mind, but something kind of overrode that, where I was like, I need to have this baby on me as much as possibly humanly like available. And I think partly it was my own way of dealing with that trauma, not really knowing all the details at the time. That was the first time I had ever heard about kangaroo care. They just said you can hold the baby now. I had no idea why that was a good thing to do. I just know that I couldn't wait. And then as I started to find out that that's important, I wasn't so much worried about like my germs. I certainly was not about to let anybody else come and hold her, but other than my husband. But yeah, it was for me, it was kind of the experience of I just really cannot wait to have this little baby on me, and that felt really comfortable to both of us. And right now, yes, all those things. I have a 5-year-old in school, so like we have a bit of a ritual to mention the germaphobe thing, where she'll come home from school, and we've reframed it in a way that serves. Like she'll come home, but I want her to take a bath like immediately. Like no playing with the baby before we're done that. But we frame it in a way that it's relaxing for her, and it's an opportunity to like, have a nice warm bath and like have some bubbles. So, but really it's because I don't want any germs around. So yeah, that will continue. Like anytime something happens, I'm gonna be like, not this child. But I think yeah, I couldn't wait to hold her.
I wanted to ask if anyone has suggestions for parents who can't make it to the NICU all the time, because, every family is so different and everyone's going through different things. Or, parents who might have twins and in different pods, but anything, to help them if they're feeling guilt for not being able to provide kangaroo care every day or as much as they'd like to, or, how parents of twins could help them to manage their time between both twins, because it's very stressful. I know during COVID, it was one parent in 24 hours, so one parent had to split up their time between twins in different pods. So if anyone has any suggestions.
Mine is not long. I just feel so deeply for all the different nuances that this journey can take. Just such a deep feeling towards that. And I know ours is just our own unique one. Everyone has it. And I guess guilt, feeling guilt for whether you can't be there or leaving them there or whatever it is, there will always be guilt involved in this journey. I don't think it's fair to say that you can actually like diffuse that and not feel it. But from my perspective, it would be to get support in feeling that guilt and to recognize what you can do. Doing it, like, again, presence and intention are huge in my whole life and in everything that I do. But if it's a situation where it really is out of your ability and control, then learning to kind of process that within your own system, so that way when you do show up, you can be fully there, and knowing that whatever amount it is, it's enough, and it has to be. So I think, I don't know, that's not really an answer, but
No, I think that's really important, because that's kind of what I was telling myself my second time around, because I did feel guilty. I wasn't there 10 hours a day the way I was with Jack. I was, I had to be home with a toddler, and I had to go to the hospital, and then I had to go back, kind of thing. So it was like holding him for one kangaroo or maybe 2 kangaroo sessions in a day. But I started to tell myself, well, I think this is enough, it's better than nothing. So Petya, thank you for bringing that up, because I think it's whatever you do is enough. And I'm hoping that gets spread out to more parents in the NICUs, for them to know, and not to feel the pressure of this needs to happen every day, but whenever you can, that's great.
And just something I wanted to add to that is with kids at home, because a lot of us, and like you experienced the second time around, Janeeta, like, what about the kids at home? I felt a lot of guilt around that, that I'm not all of a sudden there. And my daughter I'm just also so proud of her, because she's grown in such big ways through this experience. And again, we are being supported as we're going through, not one day in 10 years, let's figure out what happened. But she would have all these questions like, Mommy, why does my baby have to live in the hospital? And Mommy, did I live in the hospital? And why aren't you here at night? And why aren't you here in the morning sometimes? And why aren't you here at school pickup? And I really, again, my focus was on hopefully allowing her to know on an age appropriate level for a 5-year-old, like what is going on. That's why it was so important for us that she comes and sees the baby in the NICU and has the experience, because we're talking about it, and my guilt is relieved by connecting with both children when I can, in a way that I can. And so I'm just showing up in the best way that I possibly can at the time, because really that's all I have. I can't really do anything above and beyond what I can do.
No, I love that you're bringing your daughter into the hospital, because we ended up doing the same thing. And there was a period where there was a no sibling rule, but we were really lucky that that had just ended when we were there. But you're right, they need that bond. They don't understand unless they can be there. And even like Kangaroo Care, being able to take Jet out and hold him and have my toddler, see, that was way different than Jack looking into the isolette, because when you look into the isolette, he was thinking like toy or something. I have a picture on my presentation. The first picture above is he's actually putting his hand in and he's grabbing Jet, like he's trying to pull him out. But when I have him on me, he can get a better understanding of what's going on versus thinking he's a toy. And that's like a perspective of a toddler. Now,
Yeah.
if you have like a teenager, maybe they can hold the baby too, and that's really great for them to have that bond. Because I know the family next to us, they had some older children who were able to come and provide kangaroo care, which was really sweet to see.
Yeah. I was Maya was 4.5 at the time, but the rule when they started opening up again was 5. And so I really had to be that parent and question that. I went up to the NICU management and just had to ask, like, why 5? Is there really set reasons as to why? Because I have a 4.5-year-old and she's very mature, and I believe that this would help us heal all as a family if she has the experience of visiting actually the hospital where her sister has been. And so we were able to get that okay. Like they said, okay, she can come and visit, for this time.
Good for you.
So I feel good about that, again, because I felt like it would be really helpful for all of us to have our own experience of the whole thing.
Eugene, in your conversations with families, how do you balance that pressure versus telling parents how important it is to do kangaroo care?
Well, I mean, I guess it's important for us to understand that everybody has their different life circumstances, and no one set of routine that fits everyone. And so it is actually important for us to have that understanding, because otherwise people will feel judged, or that people will feel guilty, because that maybe other people will give you the evil eye to say, well, how come you don't spend time here? But you gotta have to understand people's circumstances. So we have what we call a care conference that we as neonatologists would do, and we started focusing first of all on some of our longer term patients. So we started with the micro premature babies, less than 26 weeks, that we will routinely sit down with the family, and not just to give an update on a medical condition, but really to talk about this, to really try to, we have a forum. We try to understand, what is your barrier for coming in, what pressures you have at home, what is your family circumstances, what are your family support system, and then we go into some of the things like, the things you could do as parents, and what is your role, attending rounds, asking questions, and then to doing kangaroo care or hand hugging, spend time, and so on. So everything is trying to sort of create understanding between you as parents, as a member of the healthcare team. You're not a visitor by any means. To say that how we together, parents, healthcare providers together, can look after your baby. So I think that's an important understanding. Is okay. So we need to understand that, well, spending time at home for your baby, for your other child, is an absolute essential thing you have to do. And so you cannot feel guilty about that, because that's also your responsibility. So not being able to spend enough time in the unit what we do is to work around the solution. And Petya, you're right. Any amount of kangaroo care is good enough, because it's better than not doing it. And no, so the other thing that we have implemented is the volunteer cuddlers, and they don't do kangaroo care because obviously that's not appropriate, but they will at least cuddle. And as I was saying about all these other interventions that we think will help wire the brain, having that kind of human interaction when parents cannot be here is as good as it can be. Not a total replacement whatsoever for parents' voices and touches and kangaroo care, but it's better than nothing. So I think we've implemented that program with a tremendous buy-in from parents, and we approach parents to say that, you know what, if you can't be here, is it okay if we have one of the volunteer cuddlers come and hold your baby, sing, read, and do some human interaction for your baby? So that's another solution to dealing with families' life circumstances that is beyond your control, that you cannot be here all the time.
Did either of you, Petya or Janeeta, did you have a volunteer cuddler, or did your hospitals do that at the time you were in?
So for us, I don't think it, perhaps it was a volunteer. I don't know. Maybe it was part of staff. But at Sinai, we had a primary nurse. And when I wasn't able to go in, she said, don't worry, like I gave her all the love. We cuddled today, so I think she did some of the cuddling. And then at the next hospital, we did have like floating, I believe, nurses or helpers. I'm sure there were nurses who did that. But what I wanted to say about that is, in my experience, and I'm sure hospitals and staff are different everywhere, but in our experience, I have multiple times said to the nurse that's taking care of Raya at the time, thank you so much for actually giving love, like their tone of voice and the ability to, explain to my baby what they're doing. And I just loved seeing that, because that's what I would wish when I'm not there happens, right? And some of them just were so angelic in their approach to these little tiny babies, and I really appreciated that. I wanted them all to know that was wonderful, like just the way that she was talked to, and they would say hi first and what they're doing, and because my baby was like, she'll look at you and she's just like, and now what are you doing? And like you can see her awareness was there, and so it was just nice to see that the approach is one of, like, there's just that energy of love being passed on. So
I love that. But to go back to just Leah's question, then I'm going to come back to you, Petya. Our hospital does have the volunteer colors, and that program was there at the beginning, but then with COVID, they had stopped it. And I believe now recently they're in the works of bringing it back out and having the volunteers come. But I did see firsthand, there's cases where there's a foster infant and, there's no parent there to cuddle the baby. So in that instant, I did see a volunteer cuddler in the level 2 nursery. Petya, I love what you were saying about the nurses, because I felt the same way when you saw your baby being treated as a human. You feel relieved. You appreciate the nurses, and we would let them know too, like seeing them, talk to them. Like I used to feel so guilty when Jack became bigger and he was aware, because you're right, they just like look and they stare, and sometimes the nurse was like, he was awake from 5 to 7, he was just staring, but it was a little busy, but I was able to get to him, I was talking to him and stuff like that. And you're like, I really appreciate that, because you feel, at that time it was COVID, so I couldn't be at the hospital every day. For my husband to go, I had to make that sacrifice and stay with him. So you kind of get sad thinking like, oh, my baby was like alone and just staring, and you just feel bad for them. But knowing that the nurses are taking, like, it kind of feels like an extra initiative, even though it isn't, because a lot of them just naturally do it. But for us, it's like a very big deal for them to have that human interaction and not so robotic, not so medical, but reminding us we're humans and emotion is really important.
Yeah, so powerful because that's exactly it. It's not like a next, like do
Yes.
the thing and next. Like we get used to it because when you're at work and you're doing the same thing, it doesn't matter what you do, it becomes a little bit routine and
Mhm.
automatic. And I didn't necessarily feel that when I was there.
Yeah.
I know that I've told the story multiple times, and it's only because it was so powerful for me, is that there was a day that I came around the corner to see Tessa, and her nurse was there singing Meatloaf to her. And
Aw.
music is such a special thing in our household, and I always felt like NICU babies often get ripped off of that opportunity to hear music unless people play it at the bedside. But we didn't. We would just sing to her. And so here was this nurse singing to her, and I was like, I love that. She was embarrassed that I caught her, but I was like, no, that is meaningful for
Mhm.
us as parents to see that you love Tessa enough to sing to her when I can't be there.
We have a
Absolutely.
pilot project of a music therapist coming to our unit.
Oh,
Um,
cool.
she works somewhere else in the hospital with the veterans, and you know, she had chosen to come and do a sort of a pilot, and you know, believe me, music therapy is good for not just babies and families but staff also. So you know, if the program is kind of just finished, but you know, if there's a way that we can bring her in routinely, I think that'll be great. And you know, I don't think she's singing Meatloaf, but you know, they have
Mhm.
special instruments. They have special way of making soothing sounds. It is
Mhm.
tremendous.
Mm. And Petya, that reminds me of what you were talking about of the sound that you were making, the humming. And
Yeah.
so that was part of Kangaroo Care that was meaningful for you and something that sounds like you just came up with. But have you had the opportunity to share that with other parents when you were in NICU that you were doing this, or did the staff comment on you doing it, or?
Mhm. Not really. This is just me now, like again, processing what happened in the last year.
Right.
I just know the effects of sound and the vibration within the body, and that
Mm-hmm.
knowledge. I know the sound of the heart, and so for me, I was trying to activate my heart vibration to give her the safety and
Mm-hmm.
comfort within myself. So that was just something that I was called to do as I was holding her. I have a few little melodies, or I would put some like music on and just hum with that, or it just letting it come through my own body with the hum. And literally the sound for the heart is hum. So it's like like it just vibrates in different areas and especially on the chest. And that's kind of what was really calming to me. Like I mean, I would teach that to a person to calm their own self,
Mm-hmm.
like in
Mm-hmm.
the moment. And that's that's what started happening. And even now, I mean, I said that a little bit, like, I still do that, and she likes to fall asleep on me, and some sleep training people would say, "Oh, no," like, but we're not there yet, and this is our safety and comfort and what we both feel, needs to happen. She does
Mm-hmm.
sometimes think that her daddy's chest is her bed, so she'll go down, she'll sleep for a few minutes or hours, and then eventually she'll end up on his chest or, co-sleep, and that's just kind of what works for us. But yeah, the holding and humming and incorporating music into our kangaroo care still to this day is very important to us.
Yeah, I think that's very powerful for both parent and baby. And just thinking about all five senses, like when I think about Jack and his isolette, I was like inside of me, he heard my voice. He,
Mm-hmm.
my heartbeat, he can smell. And then I would think like inside there, I know they would say he's nice and warm, he doesn't know where he is, but he's not hearing and feeling and smelling all the things that he was inside of me. And
Mm-hmm.
that's another thing that I would think of when I was holding him was that you want to talk to him and I would read him stories. That was our little bonding
I
thing.
love that.
Was reading like I have the stories memorized. I have like the Good Fight book, and then like there's Dr. Seuss's Left Foot, Right Foot. Like I But that was our thing. And again, like, that's one of the things that helped me with my mental well-being and stuff, having that time to create that bond with him. It was a peaceful time, but also knowing like he's getting my sense again. That's going to comfort him. He's hearing my voice again. That's going to help comfort him. Because, you know, I was seeing the isolate sometimes when his vitals are going up, and then you start to like, vitals, you know, going up and down always gets to you, and they tell you don't look at the monitor, but you do it anyways. But yeah, I definitely think bringing back those senses for them, that's really important. The feel, the smell, the touch, the hear, all of that.
Yeah. I used to also tell her at the end of like like when I would have to go home. I used to tell her like I'm just, I'm going home. I'm going to see Maya and, I name everybody and daddy and we're gonna, I'm gonna be back at this time. And it just cry again about that. It just felt good to like have, treat her like somebody who knows, even though she can't express and speak. But yeah.
Well, we're going to wrap up here in just a few minutes, but I wanted to give each of you the opportunity to kind of, if you have some closing thoughts that you'd like to share before we say goodbye for the day. I know I kind of put everyone on the spot now, but
well, now that I'm just like sort of crying already, I'll just say this. I guess what I want to say, and by sharing our story, is that we cannot know for sure where life will lead or what kind of experiences will come our way. And talking to preemie parents specifically, I think the most important thing is to be able to somehow catch yourself and know that you get to navigate a journey that you know nothing about, perhaps, or maybe again, but that in being able to stay grounded and level, layered headed as you go through this and accepting all of the support available. Like I'm saying, learning how to ask for help if you don't know yet, accepting that help and being able to say like, I'm navigating something really difficult, but knowing that things will change. It will not stay the same. So I'm only a year ahead in the preemie journey. And if I could tell something to myself a year ago, I would tell her it's going to be hard. You're going to have to really, really advocate and really learn and really be present, but things will change. It's not going to stay the same. So even the hard parts, they do not stay the same. They will move. And you'll still have to navigate. So just keep going. Get support, get help, and we go into the merry-go-round, right? Yeah.
Yeah, and to piggyback off that, I just want parents to know, they tell you in the NICU they don't have a crystal ball, but you do what you can do. Advocate for your baby. One of the most important things that was told to me was, you know your baby best. So please, I hope that's the biggest thing that I can tell every parent. Don't ever question yourself. You know your baby best, and you use that knowledge to help advocate for them and help them in their journey, because that is really powerful and that will make a huge difference. Also, I just want to thank all the medical care workers, the doctors, nurses, therapists, everyone involved, because you guys really, you're essential, and you help us out too. There's times where nurses would calm us down, or the way the doctor would approach something and lay it out for us was very helpful. So I just want you guys to know, please continue to do that, because even though it's something small that you do, you might not even know that you do it. It makes a big, big difference in our lives and what we're going through. One of the hardest time in our lives. Those little moments, those human moments, make a huge difference in us. And also thank you to the Preemie Foundation for all of your hard work, because of you, we can connect, we can work through our traumas, we can support each other. And that's what is so important right now, this community, to support each other, to help us with our journeys.
Very well said. this is probably a good note to end on with. I don't pretend that I have every last word, but first of all, I really do thank you for acknowledging, especially the nursing staff, and they are very caring people, and because if they don't care, they wouldn't be here. And as much as we are always talking about short staffing, having difficulty with retaining nurses and staff. We're struggling every day with volume. And underlying all of this is the care for a baby and their family, and that is still the most important thing. So no matter what happened, no matter how burned out people are, I think this is still a very important thing to do. So thank you for acknowledging that, and I think all the millions of nurses out there just need to hear that, to acknowledge that the great work they're doing for babies and their families. And I think that maybe the most important thing for this forum is to really understand that parents have a huge role in the baby's care. And while we're talking about kangaroo care, I think it really isn't something optional. It really isn't something that is good to do, but it really is a medical therapy. I believe that as much as we don't have the crystal ball to really know what the baby would do or how the baby would do years from now, I would like to think that doing things like kangaroo care is going to make a positive impact no matter what. So keep up the good work. And we are, after COVID, going to start running the Kangaroo-a-thon again. We're doing a quick trial of a week and see how it goes. But we really would like to sort of drum up that, encouraging people to do kangaroo care, stock up the hours and see how we can do, and break our records again. So yeah, everybody go.
I'm happy to hear that after COVID, because that kind of threw a wrench. I think no one knew what the future held and how healthcare was going to look. So even to start getting back to those things like the Kangaroo-a-thons that encourage and educate and help families to advocate for themselves as well is so important. So thank you for sharing about that.
And thank you for doing this session today.
Yeah, thank you everybody for joining us. And I mean, I think our conversation has been really helpful for those who have been watching, because it's been authentic and it's just been sharing our experiences and thoughts. And I think that is what advances the practice, when family voice is first and foremost, and then when we can also be together with healthcare professionals as well to work together to have our babies live their best lives. So thank you everyone for joining
so much.
us.
Thank you.
And thank you everyone who joined us online today for this edition of Preemie Chats. I just want to say thank you to our sponsor, AstraZeneca, for their ongoing support of this educational program. Just a reminder that if you missed part of today's session or the whole session, then again, you can head on over to canadianpreemies.org, where you will find today's show and all past editions of Preemie Chats. Also, while you're on the website, you'll find many resources and support, and you'll be reminded that CPBF is a charitable organization and it depends on support to continue its important work. And so consider how you can support CPBF in its mission to empower families of premature babies on every step of their NICU journey. Together, we can create a brighter future for all preemies and their families. Join us here next Friday as we present part 2 of this special series acknowledging International Kangaroo Awareness Day. It'll again be at 1 p.m. Eastern Standard Time, and there will be 3 guests, and their topics are tremendous and timely, including kangaroo care for extreme premature babies, the impact of kangaroo care on mental health, and its effect on hypothermic patients. So you won't want to miss that. So I just hope that you'll be able to join us next week for part 2. And I hope you all have a great weekend.